My name is Rebecca Bowers, and BP has agreed to be my patient today and allow me to do a head-to-toe assessment on her. So first, I'm going to visually look at her and inspect her skin. Her skin is intact. There's no discoloration. Her arms are warm to touch. There are no masses. There are no nodules. Her hands, there's no clubbing on the hands. Her nail bed is intact. Adherence is at 180. There's no clubbing. Capillary refill is less than 3. I'm going to check her Turner. Okay, she is not dehydrated. It snaps back quickly. Okay, I'm going to look at her legs. Okay, her legs are warm bilaterally. There's no varicose veins. There's no swelling. There's no edema. Her toes and feet look good. No edema. No discoloration. Okay, next I'm going to do her hair. Okay, her hair is clean and brown. Hair is distributed evenly. I see no dandruff. I see no lice. I see no open areas. I'm going to feel her scalp. Okay, her scalp, I feel no masses or nodules. I'm going to look at her face. Her eyes are midline. Her eyes are symmetrical. Her nose is midline. Her mouth is symmetrical to her face. There's no edema. There's no redness. Skin, there's no discoloration. Can you open your mouth for me? Okay, shut it, open again. Okay, the jaw moves smoothly without pain. Okay, I'm going to look at her eyes. Her eyebrows are distributedly evenly. There's no scabbing. Her eyes, there's no edema, no redness on her eyelids. Can you close your eyes? The eyelid closes over the eyelid completely. I'm able to feel the eye globe underneath the eyelid. There's no drooping, there's no lagging. Okay, you can open up your eyes. The eyelashes are evenly distributed and they're sloping outward, which is a normal finding. I'm going to palpate. Okay. I'm going to palpate her lacrimal gland duct. Okay, there's no tearing. Does that hurt? Okay. I'm going to palpate your face. Does this hurt?
No.
Does this hurt?
No.
Does this hurt?
No.
Okay. Okay, I feel no nodules. I feel no masses. Next, I'm going to look at her nose. Like I said, her nose is midline. I see no trauma to it. There's no open areas. It's no discoloration. It's not swollen. Okay, lift your head up. Okay, the mucosa is pink and moist. The turbinates are pink. Okay, can you hold a nostril and breathe? Blow out. Good. Now the other one. Okay, nostrils are patent. I'm going to do, can you frown for me? Can you smile? Can you move your eyebrows up, down? Can you stick your tongue out, side to side? Okay, purse your lips. Puff your lips. Okay, her cranial nerves are intact. I will next look in her mouth. Her lip, you can close it. Her lips are moist and pink. There's no fissure. There's no cracks. Okay, you can open your mouth. Stick out your tongue. Okay, the tongue, the tongue is pink. There are white taste buds on it. Okay. The roof of the mouth, the hard palate is pink with white overlay. Okay, I'll check the mucosa. Buccal mucosa is pink and moist. The Stevens and Wharton ducts are intact and they're not open. There's no lesions in there. Okay, stick out your tongue again, lift it up. Okay, the frenulum is intact. Stick out your tongue and say ah.
Ah.
Okay, uvula moves up and back, which is normal finding. Okay, I'm going to look in her eye now. I'll do Perla. Okay, watch this. Go in, go out. Okay, just look ahead. Okay, she is positive for Perla, which is our pupils are equal and reactive to accommodation and light. Okay, I'm going to look at her eyes. The sclera, can you look at me? The sclera is white, iris is green, the pupil is black. There's no exudate. Okay, look up. The conjunctiva is pink. Okay, and when I do one side, it's expected you do the other side. Okay, so look at me. I'm going to look in your eyes. I see the optic disc, and I see the physiological cup, which is roughly 1/3 the size of the optic disc. I see the the AV is 2/3. There's no arterial nicking. I see the macula and the fovea centralis is within normal limits. There is no hemorrhaging. There's no exudate. Okay. Next, I will do the I'll do the ears. Okay. The auricle is firm. I see no nodules. I see no masses. The pinna is able to be snapped back without any problem. I see no drainage. Okay, I'm going to look in the ear. Okay, I see the tympanic membrane, which is a dull gray. I see the reflective cone of light. I see the malleus with the umbus and the paratensa. Okay, I'm going to palpate your spleen. Good. Okay, am I hurting you?
No.
Okay, I don't feel a spleen. You can lay on your back. Okay, I'm going to percuss. Okay, I'm going to percuss your liver and see how big it is. Okay. Okay, it's about 5 centimeters, which is a normal finding. So now I'm going to also take the arteries. This is the aortic. Okay, there's no bruits. I'm checking the renal. Okay, the iliac. Okay, the femoral. Okay, they're all present and not bounding. Next, I'm going to check her musculoskeletal system. I'm just going to have you lay there. I'm going to bring your legs up. We're also going to check her range of motion. I'm just going to check one leg, but normally you'd be checking the whole body. Okay, I'm going to bring it all the way up. Good. Bring the knee in. Okay, now I'm going to invert the knee. Good. Okay, now expert the knee. Good. Now I'm going to apply pressure. You lift your leg up. Okay, now you push it down. Okay. Now spread your legs wide. Bring them together. Okay. You see your arms. Okay, we're going to move it in a round motion. Good. Okay, all the way up, down, to the side. Can you bend your arm? Do your joints hurt?
No.
Okay, I'm going to look at your wrist, turn it all the way around. Okay, like that. Okay. Use your fingers. The joints hurt?
No.
Okay, spread your hands wide. Try to force my, okay, now put your hands in a bowl. Okay, and spread your, good. Okay. Next we're going to do your feet. Okay, I'm going to check the home inside. So you push your foot. Does that hurt?
No.
No? Okay. We're going to rotate your ankle. Does that hurt?
No.
Okay. Can you move your toes? Okay, now push my hand. Good. Push it back. Okay. Can you stand up for me? Good. Okay. Can you bring your shoulders in and then out and then rotate them like that? Now the other way. Okay. Lift your arms up over your head. Okay. Okay. I'm going to try to push it up. Okay. Push it down. Okay. Now I want you to try and do a shoulder shrug. Good. Now try and lean back just slightly. Okay. Okay, now turn from side to side. Good. Now I'm going to check for scoliosis. Okay, can you bend down? Okay, the spine is straight. Stand up. Can you kick your leg back for me? Good. The other leg. Okay. Now I want you to take a couple steps forward, just a couple. Okay, her gait is steady. Okay, you can turn her back around. I want you to do heel to toe now. Her gait is steady. She's able to walk simultaneously with her arms hanging to the side. Okay, now on the tippy toes. Good. Now turn around. Okay, now, okay, turn around one more time. I'm sorry. Okay, now I want you to go backwards on your tippy toes. Good. Her position is good. She's stable. Her stance is regular, at ease. Her musculoskeletal wise, she is strong. They're bilaterally the same strength. Range of motion is good. We're going to do a sense. Can you close your eyes? Okay, stick both your arms out. Okay, now touch your nose. Okay, now open your eyes. Okay, her sense of perception is good. Okay, now I want you to, let me see one of your hands. Can you tell me what I am drawing in your hand?
An O.
Okay. I'm going to place something in your hand. I want you to grasp it tightly.
Some sort of ring.
Okay, good. Now I'm going to do your senses. Can you tell me what this is?
Cinnamon.
Oh, good, good, good. Okay. Next, I'm going to give you something to taste and you tell me what it is.
Bubble gum.
Okay. Now I'm going to check your hands. Can you go back and forth as fast as you can? Good. Now can you sit down and point and flex your feet as fast as you can? Point, flex, point, flex. Good. Okay, I'm going to check your reflexes. I'm going to check your brachial. Okay, just let it hang. Okay, now I'm just looking for the bicep to move. Okay. I'm going to check the ulna. We're watching the thumb. Okay. I'm going to check. Okay, now I just want you to relax your leg. Okay. And now I'm going to check her posterior tibia in the back. Okay. All her reflexes are good and intact.